Hospitals across the state are nearing last year's peak, driven by this latest COVID-19 Omicron surge. Good evening and thanks for joining us. I'm Marcella Lee. That is just one of the reasons state officials are now extending the indoor California mask mandate. It was set to expire on January 15th, but will now expire on February 15th. And as News 8's Kirsten Holmes found out, schools, businesses, and hospitals are all having to pivot to meet the demand and needs while keeping you safe.
Almost 2 years into the pandemic, and the latest Omicron surge is forcing a lot of people to make changes on a dime. As positive cases hit healthcare, law enforcement, and school levels of all ages, universities like San Diego State are making the first 2 weeks of their school year virtual as we all adjust to this hopefully temporary new normal.
So if it does anything like it did in South Africa, we'll have a really high mountain to climb really fast, and then it'll drop off really fast.
Dr. Davey Smith is the chief of infectious diseases and public health at UCSD and says we're in for a tough 3 to 4 weeks, prompting San Diego State University to not start in-person learning until Monday, February 7th. The good news is Wednesday morning, the San Diego County Office of Education distributed nearly 200,000 test kits for schools as part of the 6 million tests promised from the state so that kids can get back to class after winter break. The bad news, though, California hospitals have 51,000 inpatient stays, nearing our peak of 53,000 last winter at the height of the pandemic, putting a new strain on our already overworked and now short-staffed hospitals as healthcare workers are now being hit hard with positive cases and quarantine.
When they get infected, they might be doing okay because they're vaccinated, but that means they have to be at home and not taking care of other people in the hospital.
Also hit local high school sports as San Diego Unified has now paused off-season athletic practices for the remainder of January.
If we had more people vaccinated and more people quarantining, then we could flatten that curve and it would be less of a strain on our healthcare system during the next month.